Upper Limb Spasticity, known as ULS, can affect people who have experienced a stroke, traumatic brain injury, or multiple sclerosis. ULS makes their return to day-to-day activities even more challenging. Dr. Glenna Tolbert, a specialist in physical medicine, rehabilitation, and spinal cord injury, explains this condition and a promising new treatment.
Upper limb spasticity is when the muscles basically malfunction after damage to the brain or the spinal cord. And so the muscles basically go haywire. Now, this can be from a variety of causes. It can be a stroke, which is the most common, infection, cancer, snapping your neck, a fall. What happens is the muscles are no longer getting those messages from the brain or the spinal cord, and they just go haywire, and they constantly fire. They never shut off. The brain and the spinal cord no longer are controlling these muscles.
Dr. Tolbert demonstrates what ULS patients experience.
Here's my hand. Bend your wrist. You bend your wrist and push it and push it and push it. Pain. Now clench your fist and keep that wrist pulled down. Welcome to the world of ULS, or upper limb spasticity. My patients who have ULS have chronic, horrific pain.
Dr. Tolbert discusses the treatment options.
What we always do as doctors, though, we always start with physical therapy and teach the family also. And what happens in physical therapy is trying to stretch out those tight muscles. But guess what? I explained to you that it's neurological, meaning there is damage to the brain and spinal cord. So this is like cement, trying to pry cement. And so we then use medications, and these medications are often pills, but you're taking a pill that's going throughout your whole body for a problem that's right here in your hand. So we have prescription injectable medications. We can perform it right in the office, and think about the painful muscle. I inject it right into that tight muscle, and wow, relaxation. It happens that quickly, but actually it peaks in about 2 to 3 weeks. But my patients notice something immediately.
Ruben Ayala struggled with ULS after suffering a stroke. This new treatment has been very effective for him.
I had this stroke in March 2011. It left me paralyzed on the right side of my body. First time I got the shot, I started releasing my muscles and some of the spasms I was getting on my body. It gives me so much confidence right now. I can pretty much feel normal once again.
The name of this injectable medication is Xeomin, and it's the latest approved medication by the FDA for relaxing these painful muscles for ULS patients.
This medication has been very helpful to help patients do more activities of daily living.
I actually had a little boy who, after I injected him, he came back and I said, "Johnny, how are you doing?" He took his hand and gave me a thumbs up. Mom said he now could hold scissors to learn how to cut in kindergarten. I think about the stroke patient whose husband brings his wife in, and she no longer can do the things that we take for granted. Holding a spoon and feeding yourself, combing your hair, that now maybe her husband has to do for her. But after this treatment, things we take for granted, being able to hold her loved one's hand, it's a game changer.